Have you noticed that the COVID-19 deaths in the United States have plummeted over the past 2 months? They've dropped by nearly 75%. But the mainstream news media isn't talking about that, are they? They've switched gears and they're focused primarily now on an increase in cases of COVID-19. Well, that increase in cases is due in large part to the increase in testing that's going on. And we're going to talk about that in this video. I'm Dave DeShan, editor and publisher of the Fort Fairfield Journal. I've been studying this COVID-19 business since it began here in the States in mid-March. And I've been watching the mainstream media and how they've unfolded the story. And I've reported on it in many issues of the Fort Fairfield Journal and exposed how the media is skewing, slanting, and otherwise outright lying about the data in order to prop up the authoritarian big government model, which seems to have taken hold in this country for some reason, and I'm not quite sure why. So we're going to talk about the increased tests, we're going to talk about the surge in cases, and we're going to talk about how the deaths have plummeted in this video. So now let's get to it. In the opening salvo of the virus, around 60,000 to 100,000 COVID-19 tests were being processed daily in the U.S., compared to over 600,000 tests per day by July, a 6 to 10 times increase in total tests administered. This you can note by checking out the blue bars in this chart. Tests peaked to over 822,000 total tests in a single day on July 10th. By capturing a wider sample base, there will obviously be more total positive cases for a virus that has ubiquitous spread throughout the country by now. But that increased sample size shouldn't necessarily be construed as a gigantic spike in new infections, as the media and state governments are attempting to sell to the public. In fact, the recent spike was a less than 3% rise in daily positive cases from the low point in mid-June. Now keep in mind, I'm not making these numbers up out of thin air. For the YouTube video censors, before you hit delete on this video, I think you should know that the numbers I'm citing and the graphs I've built are from data that has been derived from the Johns Hopkins University website and the United States CDC. I've even gathered data from your own Google World Coronavirus Map. So this is all, quote, official data that's out there. It's just the mainstream media is ignoring it. In order to bring the daily testing numbers with differing sample sizes on par with each other, they should be converted into positive cases per 1,000 tests. This way, a smaller sample set taken at the beginning of the pandemic can be more objectively judged and compared against a much larger sample set taken several months later. When adjusted to positive cases per 1,000 overall tests, it has been found that the so-called spike or surge is nothing more than a small pebble in the middle of a moderately bumpy road. Check out the yellow line here at the bottom of this chart and you'll see. Looking at positive case numbers without adjusting for the total sample size can be a bit misleading. For example, on March 27th, there were 19,043 positive cases of COVID-19 identified in the U.S. on that day. Nearly a month later, on April 26th, that day logged 27,412 positive cases of COVID-19. That does look like an increase in daily cases until you consider the sample size. On March 27th, The 19,043 positive cases came from a total sample size of 103,461 tests processed on that day. The April 26 positive case number of 27,412 came from double the sample size, or 206,550 total tests reported out on that day. So, adjusting the positive cases to per 1,000 people tested, March 27th had 184 positive cases per 1,000, while April 26 had actually dropped to 133 positive cases per 1,000. You see, this is how the mainstream media misleads you. They give you numbers out of context, and then they present them in a way that makes you think the way they want you to think. What they would rather you not do, however, is actually go to the CDC's site or go to the Johns Hopkins site and check these numbers out for yourself with the full context. And that's what these bar graphs here that I've provided for you are attempting to do. In the middle of March, with around 17,000 to 45,000 COVID-19 tests administered, the positive case per 1,000 averaged around 174 per day. That number increased slightly to 181 by the end of March and peaked to 211 in the first week of April. The daily average positive case per 1,000 then began a steady decline by the week to 191, 144, 116, 90, 64, 56, 53, 45, and finally bottoming out to a daily average of 44 positive cases per 1,000 by the middle week of June. There has been a slight uptick in that daily average since then, the so-called spike or surge, as illustrated by the media, to 51, 68, and 75 positive cases per 1,000 by the first week of July. While it is a slight increase from the 44 positive cases per 1,000 trough of mid-June, 75 positive cases per 1,000 is still a 64% decline from the peak in positive cases during the first week of April. But there may be some reasonable explanations for this increase that have nothing to do with new infections of the virus. For example, there are reports from some patients in Arizona that when they are counted as COVID-19 positive, they are told to come back in 14 days to be retested. If they test positive again, and they probably will even if they recover because the dead virus RNA particles may still be in them, that second test is counted as another positive case. When asked why they're double counting the same person as 2 or more cases, one nurse explained, "We are counting positive tests, not individuals." Now, this whole exercise in numbers could be merely academic, since the dominant testing platform is the PCR test, which was hastily built and rushed into service with the U.S. Food and Drug Administration, suspending nearly all of its testing and verification procedures for allowing new tests to market. Now, a positive PCR test doesn't have a whole lot of meaning. All it's searching for is the RNA particles in a COVID-19 virus in this case. It's not telling you anything about the viral load or how many virus particles are in a person. It's not telling you how the virus is presenting, which means what symptoms it's going to cause to occur in that individual. And it's not telling you how far along they are. Or, as I said, dead virus particles can be detected in some cases up to 6 months after the fact if they haven't been flushed out of your body's system yet. So these PCR tests have got to be looked at and taken in that context. Now, an analogy to this PCR testing procedure would be like if you were in an airplane flying over the woods, looking down, and you were trying to determine if there was a dog in the woods. Well, you could look down and you could see, okay, I see a dog. But that flyover is going to leave you with a lot of unanswered questions about that data you just collected. For example, you're not going to know if the dog is hungry. You're not going to know if he just ate. You're not going to know what his temperament is. You're not going to know if he's going to bite you or growl at you if you get down on the ground and approach him. You just don't know enough information by a brief flyover that all it tells you is there's a dog in the woods. Well, that's what a PCR test does. All it tells you is that there's an RNA particle of COVID-19 virus supposedly in you. I know the media likes to put a lot of faith in them, but it's a rather complicated process for how these PCR tests amplify the virus in order to detect them. And of the dozens and dozens of manufacturers, there are as many different parameters to allow for registering them as a so-called successful test. There's no uniform, unified set of parameters or guidance on how these tests are supposed to be done. Every manufacturer has been allowed to come up with their own criteria. So some may test positive, some may test negative. Who knows? It's a crapshoot, really, with these PCR tests. But we're putting all of our faith in these PCR tests and counting them as surges in cases when they've really got to be looked at as like you're in an airplane flying over the forest and you see whether or not there's a dog in there. You just don't have enough information with PCR tests to be able to make any other determinations about the virus than that it might be in you. Skewed numbers aside, there are several reasons that can be attributed to this decline in deaths to what appear to be a more normal, reasonable level. They are, 1. Doctors are learning more about this disease and how to treat it. Many drugs and techniques used in other disease treatments are being found to be effective at treating the symptoms of COVID-19 until the person's body is able to recover from it. 2. The virus is simply burning itself out. Initially, the virus found a population of easy targets in the frail, elderly, and immune-compromised sector of the population. As those victims succumbed to the virus, the available hosts left over were of better health and better able to defend against the virus. Thus, the virus is succumbing to the law of diminishing returns. And finally, 3. Doctors have started to count the deaths more objectively. At the beginning of the viral outbreak in the U.S., the U.S. Centers for Disease Control was suggesting doctors count every death as a COVID-19 death if the person died for any reason at all, but at least tested positive for the virus particles in their body. There was even a financial incentive by Medicare to provide additional money to hospitals who claimed to have COVID cases, hospitals that were unable to make any money otherwise due to shuttering all of their non-COVID services. Perhaps doctors have started counting the COVID-19 deaths more accurately and objectively than they did initially. But new guidelines in Texas are now skewing the death numbers higher again as more people are counted as COVID deaths than have actually succumbed directly to the virus or even been tested for it. Now, it could be either one or the other or all three of these potential possibilities to explain why the COVID deaths are dropping. Some researchers are even suggesting that during the summer months, perhaps the viral load is a little bit lower in people because they're outdoors more and they're not enclosed and in confined spaces, which is where the government wanted us all to be in the opening of the virus. That is, in March, April, they wanted us all stuck indoors, rebreathing the same air and spreading the virus around amongst each other, which is exactly why it went through the nursing homes worldwide as much as it did, because they simply didn't contain the virus. They just kept people who were infected stuck in the same room with other people. That's not a good move. I hope they learn their lessons from that, or maybe they really do want lots of deaths and they're going to keep that particular mistake going. The most telling sign that the death rate isn't as bad as it was originally proclaimed to be is that the mainstream news media isn't talking about it anymore. They're disinterested in how many people are dying. We're still hovering right around 700 and 900 deaths per day, if you can believe those numbers. But that's a far cry from the 2,300 or so deaths per day on average in mid-April. So we've really bottomed out. And there's a lot further we can go, but there's going to be a point where they're going to level off. But like car accidents and other diseases and other accidents that can cause death, you're going to have a certain number of them in society anyway. You're never going to totally and completely eliminate them. It's just going to be a risk assessment that you're going to have to do in order to live with this virus, which is probably going to be around indefinitely, like the common cold and the seasonal flu and AIDS and malaria and all of the other diseases that we live with that kill people, unfortunately, every year. But we don't shut societies down because of that. We don't reduce the speed limit to 5 miles per hour and wrap everybody in bubble wrap, okay, just to prevent traffic deaths. So far this year, worldometers.info has reported over 700,000 traffic fatalities worldwide. That's 200,000 more than COVID-19 has supposedly killed. So we have to get over this anxiety and this hype and this fear that the mainstream media is constantly and incessantly instilling into us in order to bring our lives back to a semblance of normalcy and understand, yes, we're going to have COVID-19. Yes, it's unfortunately going to kill some people who have compromised immune systems, who are frail and elderly. But otherwise, the vast majority of the public is going to fare just well with COVID-19, just as they do the common cold, just as most of them do with the seasonal flu and other sicknesses that we are exposed to on a continual basis, but have never in the past, at least past recent history, shut down our society. So we can continue the hype and continue focusing on the media's altered, skewed, and distorted narrative, or we can decide, shut the television off, shut off the major networks, stop listening to them, stop clicking on their clickbait, and let's show them that the numbers that they're reporting aren't having the effect on us that they want. And then when they see that they're losing viewers, perhaps they'll readjust their strategy and start providing a little more context to their numbers. We can only hope.